Welcome back, everybody, to the GuideWell Insights Lounge. My name is Kate Warnock, and we're here at day 3 of Singularity University's Exponential Medicine. I have a distinguished guest with us here today, Pritpal Tamber. Pritpal, welcome to the interview.
Hi, thanks.
Pritpal is the founder of the Creating Health Collaborative. Pritpal, you've made a statement that's very compelling. Why have you given up on healthcare?
Wow, what a way to start. Okay. The healthcare industry is predicated on sickness. It's actually one of the worst named industries going, right? So it's all about sick. If you're sick, we can provide you services. Even when you talk about preventable services, what we're really looking at are what are the risk factors that are likely to make you sick. So one way or another, healthcare is a sickness service. What I'm interested in is health. So what is health and how do you care for it? Now, whenever I say that, people always assume that what I'm talking about is wellness. But if you look at what people describe as wellness, that's really just prevention in disguise, which, as I've already said, is kind of a time-delayed version of sick care. So what is health? What is it that people say and feel that makes them feel healthy? My view on the future of health is about trying to understand what is it that people in communities actually want of their lives and what do they define as health. Rather than wait until you're sick, what is health from their perspective?
Understood. So I'm sure that takes us to the next question. Tell us about the Creating Health Collaborative. How does it work?
So I've been saying this, I was the physician editor of TEDMed 2013. I looked at a lot of innovations. And one of the things that I was really clear about was that the future of health the future of the healthcare system is severely limited by the rising cost of care. So this is not about aging, it's not just about chronic conditions, it's just simply the fact that drugs, devices, and technology are just rising the cost of care to the point at which it is economically unsustainable. So since putting on that program, I've been on the road trying to work out, okay, if all we can do is increase the cost of the delivery of care, how do you offset that? And clearly that's about people being healthier. So when I started this, I started saying, well, okay, so we have to go into communities and tell them to eat better, to exercise more, to do this, that, and the other. But actually, if you actually go into communities that are suffering ill health, you realize that they've got way more complex social circumstances than the healthcare system is particularly interested in. There's a beautiful article in The Lancet right now, which I'll talk about in my talk, where they describe a grandmother in Baltimore who has to take care of 3 grandchildren because her son has HIV and he's addicted to certain drugs and he's become problematic to the point at which he's been banned from their lives. And so she has her own health issues. And so if you want to go to her and say, we need you to exercise more, she's going to say, well, I got to take care of 3 grandkids. I have a son who's disappeared. You need to eat more fruit and vegetable. I live in a food desert. You need to sleep more. I have 3 kids who are constantly problematic. So actually, our messages from a healthcare perspective to her reality are completely unworkable. So how do you start from what she wants and build from there? The Creating Health Collaborative is a group of people trying to operate in that way. So how do you go into a community, understand their perspective on health, and try to help them achieve that? Now the interesting thing is when you go into a community and you say, what do you want? 99% of the time, they say, remove the dog shit and put in some street lamps. And that's what they say, over and over again. That's what they always say. Now why do they say that? Now, from a public health perspective, people say, oh, you want to remove the dirt on the street so you can do more exercise. No, we just want to feel pride about where we live.
Sure.
You want to have lamps so that you can feel more safe. Yeah, it's true, and then you can do more exercise. No, I just want to feel safe. Right. So pride in your area, pride in your community, and safety of where you live are actually versions of health. Now, that's not what a healthcare system can deliver, but it's actually what those people want in their lives. So how do you deliver that? We don't really know. So the Creating Health Collaborative is a group of people all trying to work out how do you do that. And one of the things that I have a massive bias towards is entrepreneurs and against talkers. I think people kind of just can talk, forever about stuff. I'm interested in people who are actually trying to build work to try to understand this space. And that's who the 22 people in the collaborative are.
Pritpal, it's such a fascinating conversation. Are you really trying to tackle head-on social determinants of health?
I think that's how the healthcare system perceives it. So the healthcare system looks at social circumstances and says, these are the social circumstances that determine your health status. That's the healthcare perspective of this. What I'm saying is let's remove healthcare's perspective. Healthcare is interested in sickness. Let's try to find a positive spin on that and say, let's build from what you want in your community. Now, those may be what the healthcare system calls the social determinants, but they may also not be. So is civic pride a social determinant of health? I don't know that anyone's done that study, and yet when you go to a local community, that's what they care about. Now, I've used a technical term for someone saying, remove the dog shit so I feel better about where I live. I'm describing that as civic pride. They just want the dog shit removed. But is that a social determinant of health? Maybe, maybe not. If you continue to constrain your analysis by healthcare's lens, it prevents you starting from where people really are. Okay,
then you clearly lead me to my very next question. Whose definition of health matters?
Well, it's interesting. I think as the healthcare system was constructed, 50, 60 years ago, when the world was full of acute diseases and trauma, and you needed hospitals, you needed places to put people who were infectious so they didn't pass on their disease to other people. Things have changed. We're now talking about chronic conditions, lifestyle-related chronic conditions, and those are multiple when you get older. And so in those circumstances, people are going to get sick. Human beings were designed to kind of been eaten by a lion in the savannah by the age of like 42, once your knees are hurting, your eyesight's kind of deteriorating. We're not really designed to be around until 85. So once you're older and you have these chronic conditions that to some extent are inevitable, you're really in a balancing act of what it is that you want from your life. So to use myself as an example, I've had back surgery, but I still play soccer once a week. My neurosurgeon doesn't want me to do that, but that's what gives me my strongest sense of feeling healthy, even though my neurosurgeon doesn't agree. So you can immediately see his lens on my health is completely different to my lens on my health.
Sure.
Whose lens matters? Mine. I'm going to listen to my neurosurgeon, but I'm going to consider it in balance with everything else I want to do in my life. And that goes back to the grandmother in Baltimore with the 3 grandchildren. She's balancing priorities. How do you start from her priorities rather than just the healthcare system's priorities?
All right, so your response again leads me to my next question for you.
I'm making this easy for you.
You are making this very easy. What perspective do you think is missing in the discussions happening at Exponential Medicine this week?
I don't think it's just exponential medicine. I think it's actually most healthcare events and actually most so-called big think healthcare events as well. Although people talk about being patient-centric, we still only want to talk to people about their disease or their possibility of disease. We don't really talk to them about what they want from their life. And so the perspective is not so much that we're not really looking for the patient's perspective, we're looking for people's perspective of what they're trying to achieve. Health is a means to an end. It isn't the end itself. So in order to try to better work out how we serve the communities that we allegedly serve, we have to actually start by working out what are they striving for. And so I don't ever see that. I see that very rarely in any healthcare event, and I'm not sure that I've felt it too much at Exponential Medicine. I think I've heard people occasionally say wellness. I've heard people occasionally say social determinants. If you were to sit down with them and unpack what they said, what they're really talking about is prevention and sickness.
Right.
How do you really understand what people want? And one of the problems with wellness is it usually means wealthy, middle class people doing yoga. That's kind of what it becomes.
Right.
I like the word, but I also think the word is too packed. We need to get away from words like wellness. We need to get away from terms like social determinants and just get back to people and say, what is it you're trying to achieve and how can your health get you there? How can we help you as a system get you there? And what other things do we need to provide?
Pritpal Tamber, I think that you are going to lead a fascinating conversation tomorrow on the main stage here at Exponential Medicine. You've certainly given us so much to think about here today at the Guidewell Insights Lounge. I really look forward to hearing the outcomes of this talk and this new nomenclature that I'm sure you're about to develop as you work through this new definition of health and wellness. So thank you so much for joining us here today at the Guidewell Insights Lounge. My name is Kate Warnock. We'll be up again in just a moment with our next interview.